When the minister is ready, could you please turn your mic and camera on?
Good morning.
Will the Committee of Supply please come to order? Before we begin, I have a leave request for this section of the Committee of Supply. Our long-standing practice is for the opposition to sit at the committee table to the right-hand side of the chairperson. Because the minister is participating virtually this morning, I am asking if there is leave of the committee to waive this practice. This would make it much easier for the members of the opposition to see the screens that are situated in the room. Is agreed? Agreed and so ordered. This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Union Station.
Thanks. Thank you, Mr. Chair. I believe our last time we were here in committee. I'm good? Okay. The minister was actually answering a question that I had asked regarding the renovations at St. Boniface Emergency Room. I'd asked specifically when that project will be complete and what is the budgeted cost. So I'm going to hand it over to the minister. She was in the middle of providing her response.
The Honourable Minister of Health.
Thank you, Mr. Chairperson, and I thank the member for Union Station for bringing forward the question about the St. Boniface Hospital Emergency Department expansion and construction on the expansion and modernization of the St. Boniface Hospital Emergency Department has officially started following strategic design, planning, community and stakeholder consultations, and preliminary demolition work. The changes at the new emergency department, state-of-the-art design, will reduce wait times and the length of stay in the emergency department, improve patient and staff experiences, and maximize functionality and flexibility. It will have expanded space for increased number of patients. I am pleased to share that the project is very much on track to be completed by 2025.
The member for Union Station.
I thank the minister for that response. Can she indicate when in 2025, what month? Is there a month and a date in 2025 that it's projected to be completed? And what is the budgeted cost? She didn't provide that response in her last answer. Thank you.
The Honourable Minister of Health. Could the minister turn her mic on?
Thank you, Mr. Chairperson. My apologies for missing that very important information. The amount of budgeted for that project is $141 million. And in terms of where it's at, I have a recent report from the Winnipeg Regional Health Authority, decanting and renovations in phase 1. Overall work progress is 91% completed. So that's the pharmacy moving from D block into new space has started, and abatement and demolition of D block. Overall work progress is 50%. So abatement is complete in the crawl space and on the second floor, 95% complete on the main floor. And demolition of D block again was scheduled to start in April and to be completed this month. New construction under phase 2. So they're tendering package 4, site works, foundation and structure. The bid award is complete and subtrade agreement is being finalized. Tender package on number 3, which is mechanical and electrical. The bid award is complete and subtrade agreements have been finalized. And phase 3 is renovations. So construction work has not been initiated yet by PCL, but I'm soon to get a report. So what I'm seeing is a lot of green check marks that say everything is on track.
The member for Union Station.
Can the minister clarify on track for what date of completion? She provided the year, she did not provide a month and date. So if the minister can provide that clarity, that'd be great. Thank you.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. So renovation started June 10th of 21. So actually work had already started last year. And as I shared earlier, phase 1B, which is decant work and relocations, is 91% completed as of today's date. Phase 2A pre-construction is 95% completed as of today. Phase 1C demolition of D block is 50% completed. And they estimate that by May 13th, again, D block should have substantial completion. And by April 21st of 2025, the new construction, the phase 2B, new construction should have substantial completion by April 21, 2025.
The member for Union Station.
Well, I appreciate that the minister has repeated some of the same information over and over. I did grasp it the first time she provided some of that information in regards to the phases, and I can appreciate that she's provided a bit more clarity on phase 2, but what I'm looking for the third time is when this project in its entirety will be completed and the projected date for that. She has provided 2025, now she's saying that phase 2 should be substantially completed by April 21st of 2025, but she has not provided when in total the project should be complete. So can the minister just, provide clarity on that one specific point? When will the project in full be completed? What is the projected date, month, day? When are they hoping to be there celebrating, probably as, members of the community coming and being there, celebrating the expansion. I'm sure she plans hopefully to be down there in some capacity in 2025, if that's in fact the year that she's saying the total project will be done. But what month are they projecting in 2025 the entire project will be completed? And if she can provide clarity as to whether or not the budgeted cost has increased from the original budgeted cost, that'd be great as well. Thank you.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. Similar to the member for Union Station, I'm not always well versed on how construction works and when is something demolished and when do we start to build. Substantial completion, as I mentioned before, is April 21st, 2025. We begin to start operational moves into the space and after all the testing has been completed around August of 2025, and we're aiming for a go-live date of September 18th, 2025.
The member for Union Station.
I thank the minister for that response. It's great to have clarity. I'm glad we finally got there on this question. I would ask that the minister provide a response to the other question that I also asked in regards to the budgeted cost for the emergency room at St. Boniface. Has it increased, and if so, why?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I'll reiterate the response I gave earlier. The budgeted cost for the St. Boniface Hospital Emergency Department expansion is $141 million.
The member for Union Station.
Has that number, that budgeted number, increased from a previous amount, and if so, why?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question. When this project was first announced in the summer of 2019, the cost was allocated was $90 million. And there has been an increase, and our government was pleased to support the continuation of this expansion and renovation and work of one of Manitoba's key hospitals. The increases are due to COVID cost increases. We're seeing that across many sectors, the supply chain as well. And so there were several challenges, supply chain challenges that increase the cost of materials and and supplies and equipment that will go into this new expanded space. That is the reason for the increase.
The member for Union Station.
I thank the minister for that response. I'd like to ask some questions around patient transfers. We know that several hundred people across the province have been transferred away from their home region. We also know that at one point, very recently, probably still ongoing from what I'm hearing, that there were many folks who have been unable to return home. In January, the minister announced hardship supports for people to be able to visit their friends, their loved ones who have been transferred. Can the minister provide an update on the current situation with transfers? Are they paused or are they ongoing?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. Like myself, the member for Union Station also worked in the health system for quite some time, and so I know that they are familiar with transfers and that people in our province cross regional boundaries every single day for care. And that is due primarily to our geography and how people are distributed where they live across the province. People are coming from the north into Winnipeg through our Northern Patient Transport Program. They are being transferred for various therapies and various treatments every day. The decisions on those transfers are being made by leadership in the health system and by clinicians, certainly not being made here in the legislative building by political officials. One of the reasons we decided to move forward with the Clinical Preventative Services Plan was for that very reason, to be able to provide services to Manitobans closer to home. And we are planning provincially, but delivering locally. I am advised by the healthcare system that makes these interregional or within region transfers that to date, 340 patients have been moved as part of their protocol. As of today, none were moved yesterday. They tell me that stable patients are being transferred to different sites for care following assessment by a clinical team. So I want to emphasize again, these decisions are being made in the health system. So that is the number that I'm aware of. And again, they continue to tell me that people are crossing regional boundaries every day for care. And they are making those decisions, Mr. Chairperson. Thank you.
The member for Union Station.
I thank the minister for that response. You know, I've had a lot of conversations with families who've had loved ones transferred abruptly with no notice to other healthcare facilities, residences. I've had conversations with clinicians, with folks working on the front lines of the healthcare system as part of multidisciplinary teams. And I would just flag for the minister that this ongoing narrative that she has taken on, her and her colleagues, in regards to this being just clinical decisions, and it's on them and has nothing to do with political decision making, is one that does not sit well with families and certainly does not sit well with healthcare providers and clinicians. They fully understand and are aware that it's the decisions made by this minister and her government that have resulted in people, hundreds of Manitobans, being transferred away from their home communities and care facilities. It's been incredibly disruptive and harmful for folks and their families. It's created a lot of distress, and it's impacted the ability of folks to recover in places where they have the support of their loved ones right nearby or right beside them. And so this narrative that I understand is likely a talking point that they want to continue to push, to shirk accountability for the conditions that she and her government have created that have resulted in 340 people being transferred away from their communities to date. I would encourage her to stop that because it is quite harmful. It's disingenuous. And it's not the approach in terms of being accountable that I think a lot of Manitobans have made clear they want from her and her government. So I wanted to put those words on the record because it is important. This is significant. It is not for any of us to minimize just how tough this reality is for the families who are navigating their loved ones, some of which have dementia, some of which when they're being transferred are incredibly distressed because they don't know what's going on or why. They think somehow it's their fault. They're away from what they know and understand, and it impacts their well-being overall. And so I just wanted to make sure that the minister was aware. Maybe she hasn't heard those things directly from clinicians or family members, so I'm sharing that on their behalf because I've heard that frequently, and her narrative around this is not conducive to folks at all seeing what this government's decision-making has done to our healthcare system, feeling any more at ease with the ongoing, as she's just indicated, the transfers are not paused. The minister's made clear that these transfers are still happening. So I'm wondering if the minister can provide some clarity on the hardship supports that I mentioned earlier. She announced this again in January for those visiting those who've been transferred. How much was budgeted for those hardship supports? And can she provide an update on how much of those dollars has actually been spent?
I'd like to ask the minister if she could adjust her camera a little bit adjust her, that would be perfect. The Honorable Minister of Health. Thank you.
Thank you, Mr. Chairperson. And again, the member for Union Station, as well as myself, we both worked in the health system. And I know for the over 12 years that I worked in the health system, transfers were occurring. And that was before even our government formed office. Mr. Chairperson, the patient transfer protocol within the province of Manitoba, if I could update the member for Union Station, has been in place for decades prior to COVID-19 and prior to our government taking office. And it's important to remember that once again, transfers are clinical decisions made by physicians, and they take many factors into account. And this allows clinicians to ensure patients who need a higher level of care have access to it. We know how difficult this can be for families. That is why our government moved to develop the hardship supports for families. And I just want to put on the record that I'm told by our health system that this month, 5 interregional transfers have occurred, only 5 this month. And again, those are decisions that are being made in the health system level, not by our government. And I want to also share that we have a Northern Patient Transportation Program that was established in 1972. And in 2015, under the previous government, 19,985 trips were made by people from the north into Winnipeg and other areas being transferred for care. So nearly 20,000 patients a year rely on this program. They're being transferred, they're being moved, Mr. Chairperson, and that's why our government invested the largest amount in Manitoba's history of $812 million this year to improve healthcare in rural and northern Manitoba, to allow for the creation of a northern intermediary healthcare hub, to ensure patients and Manitobans can receive care close to home. So this is not new. This is not related to a government. Patient transfers and interregional transfers have been done for decades. To answer the member's question about hardship supports, the policy and forms went live February 22nd, 2022. The last I checked, Shared Health advised us that a small number of individuals had requested supports. We're asking for the updated numbers. I think in March, there were only 5 requests for reimbursements. We do not have a budget for this program because we implemented this program in the midst of a fiscal year. So regional health authorities were asked to cover the reimbursement of individuals that came forward. Again, the program will allow for up to 8 visits per month by a designated support person. Meals were available. Meal vouchers were provided for designated support persons to allow them to dine with a client if meal service was not available on site. Assistance was provided to a maximum of $8 for breakfast, $10 for lunch, $15 for dinner. Transportation, return bus fare or gas expenses, and accommodation up to a maximum of $70 per night plus taxes. And I also wanted to add some factual information about transfers and when patients and families are told. So all hospital and health centers provide a letter to patients and their families upon admission, Mr. Chairperson, to hospital to detail the possibility they may be transferred to another site. So it's factually incorrect that patients and families are not being told. A follow-up conversation is typically led by a care team member, which occurs between the patient and their family member or representative to identify suitable candidates for transfers, and additional written communication is provided. That is the fact. And I just want to ensure that we're not, for lack of a better term, throwing the health system and our leaders under the bus by saying that they're not providing notice of transfers, because that is not correct. And again, we appreciate all that they do.
The Honourable Minister's time has expired. The member for Union Station.
I thank the minister for providing that information. I can certainly see why some folks maybe wouldn't be able to access this opportunity to access the hardship supports, given that the resources provided are actually just based on, even the $70 that you're talking about to contribute to a hotel stay is markedly insufficient for many folks who wouldn't be able to maybe come up with the other half of that as what it might cost to rent a hotel for one day or one evening. So certainly I can see the barriers that would still exist for many people to be able to visit their loved ones. Even the per diem amounts, I think for many folks would be insufficient. Can the minister provide clarity on it's 5 folks, only 5 people up until March have actually accessed this support. What does that look like in real dollars? So how much money was actually spent? And what was the average amount of support provided?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question, because this reimbursement program is being applied across the province in various facilities. I will have to take it under advisement. We'll have to pull that information from each facility and provide a response at a later date. I do want to speak to the member's point about the $70. I do know that regions have some discretion to look at the cost and the claims that come forward on a case-by-case basis, and to possibly go beyond the amount that is established in extreme cases. So they're certainly not bound by the parameters that have been set in the initial formation of this program. And so we'll have to come back. I'll have to come back with an update on the hardship supports and financial assistance for patient transfers. Thank you.
The member for Union Station.
I thank the minister for taking that under advisement, and I apologize. I don't think that I interpreted the information you provided maybe for what it actually was. So I'm just going to ask for some clarity. The minister stated that there had been 5 requests. Now, can she identify if that was for March of 2022 for that month, or were those 5 requests since the announcement was made in January? Just so that I'm clear on that point.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. That report came to me back in March, and they didn't specify whether it was for that specific month or since the program started. So again, I'll take it under advisement, and I will come back with a report to the member. I also want to add, in terms of my earlier comments about patient transfers, that we have a radiation oncology program, and when Manitoba was not achieving timely care for radiation therapy for cancer, patients were referred for out-of-province radiation therapy to cancer centers in Grand Forks and Thunder Bay. So even outside of our province, under the previous government. In fact, over the period of 1999 to the time when we took office, 213 patients were referred to Grand Forks. And during the period of 2001 to 2003, 13 patients were referred to Thunder Bay. We have CAR T-cell therapy that's provided on a case-by-case basis by Mayo Clinic, and that's been happening for years. So the member needs to be aware that care is provided not just interregionally, but even outside of the province, and that was happening even under the NDP administration. So this is not new, Mr. Chairperson, and our government took a very proactive step to support families and patients by establishing a hardship support and financial assistance program. That program continues to remain open to individuals who feel they would like to take advantage of that program, and we will provide a further update on its on how much of that program has been used to date. Thank you.
The member for Union Station.
I think the minister was sort of alluding to the challenges around the surgical and diagnostic backlog and the Manitobans who are unable to access what they would be able to typically access here in Manitoba, and therefore being forced to access those services in other jurisdictions. It's interesting, it reminds me of that period of time I think we all would rather forget, when the former Premier Brian Pallister actually stated that he would happily send educators, burnt out and tired educators who are going above and beyond for Manitobans to provide the best education and care they could to students, that they would have to go to America to get vaccines. It was such an interesting and challenging time. But anyhow, I'd like to ask questions about the dashboard, actually. On the government's Info Manitoba website, the province has put up what it calls the Provincial Health System Performance Dashboard. I know the minister is well aware of what that is. And over the last 2 years, financial targets in health over the previous year's budget were 1.6% and 1.4%. That's about 4% less than the current rate of inflation. It's a big gap. It also leaves very little available for any volume pressure or wage settlement. It also substantially less rather than increases through the Canadian health transfer. With all of that in mind, I'm wondering if the minister can explain why she feels 1.4% is an appropriate financial target for health spending during a pandemic.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question. COVID-related costs are budgeted in a different budget called the internal service adjustments, and they're not in the percentages that the member is referencing because it's over and above our health system budget. So COVID payments to service delivery organizations and personal care homes are, as I said, outside of the normal budget for health. And so for fiscal years 2021 and 2022, I will read into the record what has been paid out, but I do want to say that the COVID-19 response has resulted in new and additional costs to the service delivery organizations and personal care homes so that they can continue to safely provide care to Manitobans. That is why we developed the internal service adjustment budget. Under this, the province provides a quarterly reimbursement for expenditures related to COVID-19. And this includes staffing requirements, enhanced cleaning procedures, and additional supplies and equipment in acute care settings like hospitals, and again, as well as personal care homes. So for 2021 and projected for 21-22, COVID payments to service delivery organizations in 2021 is $176,961,683. Broken down for WRHA, $50,341,379. In Interlake Eastern Regional Health Authority, $7,767,194. Northern Regional Health Authority, $10,522,964. Prairie Mountain Health, $8,673,347. Southern Health, $98,144,681. Southern Health Santé Sud, $1,512,118. Actuals for 2021 for COVID payments to personal care homes, $37,110,266. Broken down for WRHA, $34,855,113. Interlake Eastern Regional Health Authority, $456,763. Prairie Mountain Health, $409,049. Southern Health Santé Sud, $1,389,341. And of course, projected for payments to service delivery organizations for 21-22, $351,873,000. And projected COVID payments to personal care homes for 21-22, $25,785,365. So again, the member can see that that is certainly outside of the Ministry of Health's budget, and it is considered internal service adjustments. And we've gone further as a government. For budget 2022, we're proud to date that we have invested over $3.1 billion in pandemic supports to protect the lives and livelihoods of Manitobans, $630 million to strengthen the fight against COVID-19 and prepare for other variants and pressures on our healthcare system, and $30 million to add 28 additional beds to our intensive care unit, which will bring our true ICU bed baseline up to 100 from the 72 we have pre-pandemic. So our government in 2021 provided supports, and in budget 2022, we are continuing our supports of the health system, $7.2 billion total for the healthcare budget in the 2022 budget. This is the most significant healthcare investment in the history of our province, and our government will continue to support our health system to ensure we recover and we advance the work that
minister's time has expired. The member for Union Station.
I thank the minister for that response and for breaking that down by region and as well for SDOs and projected for PCHs. In the minister's annual report on page 53, it says that the health transformation has achieved a net financial benefit of $23.7 million across the health system and a $60.5 million in net financial benefit since the start of the transformation. Can the minister provide more details on what makes up these purported savings?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member for Union Station for the question. My staff are pulling that information, but while we wait for that information, I do have an update on the patient transfer reimbursement dollars for the member. Paid to date, $35,486. Pending review, $5,465. Total of $40,951, and the various health authorities and health facilities have received 65 claims. Thank you.
The member for Union Station.
Thank you. I thank the minister for providing that information when she received it during this committee. That I really do appreciate that. That provides a lot of clarity. I'm wondering if the minister would just be willing to take the question that I asked her in regards to what makes up these purported savings. If she needs to take that as an undertaking, that's fine with me so that we can move forward. But I'll leave that to the minister.
The Honourable Minister. The Honourable Minister.
Thank you, Mr. Chairperson. I do want to take this moment to put on the record some of the work that has been done in the health system by our leaders, clinicians, and allied health. Everyone works together as a team. We're celebrating Nursing Week, as well as allied health professionals. And so I just want to thank them for the incredible work that they're doing. But I also want to share some information on our surgeries and how they're progressing. So since January in Winnipeg, 13,323 non-emergent surgeries have been completed, 3,604 emergent surgeries completed, for a total of 16,927 surgeries. This is in addition to the 11,000 surgeries procured by the task force through the request for supply arrangements. Just last week, I was informed that there were 1,088 non-emergent surgeries completed and 241 emergent were completed. This is over 100% of pre-pandemic levels, and in recent weeks has increased as high as 122%. In terms of diagnostics, since December, we have completed 2,947 CT scans. We've completed 3,538 ultrasounds. We've completed 1,240 MRIs for a total of 7,725 scans and diagnostics. All emergent and urgent surgeries, including cardiac and cancer procedures, continue to be prioritized. Elective and non-urgent surgeries are constantly being reviewed by physicians to prioritize patients who medically should not wait any longer for procedures to be performed. And I'm pleased to also put on the record that all staff redeployed or reassigned due to COVID have now returned to their normal duties. They're back to their acute care facilities, personal care homes, health facilities. And I hear that they are settling in very well back into their locations. And we thank them on behalf of all Manitobans for the incredible work that they did over the past 2 years. I also want to talk a little bit about the CIHI report because a lot has been said about that. And one of the important conclusions from the CIHI report for Manitobans to be reassured by is that more urgent procedures like hip fracture repair, radiation therapy, and cancer surgery was prioritized in Manitoba during the pandemic as volumes remain stable. And Manitoba compares favorably with other provinces in the areas of radiation therapy, hip fracture repair, and coronary arterial bypass grafts. And in 2021, Manitoba's hip fracture repair wait time was shorter than the national wait time, and more patients had their hip fracture repair within benchmark compared with Canada. So that was 89% versus 85%. And between 2019 and 2021, Manitoba's and national hip fracture volumes remained stable. At least 97% of patients received radiation therapy within the benchmark in all provinces. Manitoba was the only province where 100% of patients received their treatment within benchmark. So some excellent news as well for our province. Between 2019 and 2021, Manitoba and national radiation therapy volumes remained stable, which is excellent news again for cancer treatment in our province. In addition to that, in terms of cancer treatment, Manitoba's breast cancer surgery median wait decreased from 28 days to 21 days. And the lung cancer surgery median wait time decreased from 34 to 22 days. And as we all know, for an individual diagnosed with hearing the horrible news of cancer diagnosis, every day counts. So we are certainly pleased to see those decreases, while not as high as we'd like them to be. They are certainly progressing. Mr. Chairperson, so much more good news for Manitobans. We will continue as a government to work on their behalf to ensure we improve health services.
The honourable member.
Does the minister now have available, since that was an entire 5 minutes that she used to provide that information while failing to answer my question regarding providing more details on what makes up the purported savings, does the minister now have that information available to her, and is she willing to provide it?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to respond to the honorable member for Union Station's question about how we arrived at the savings. Certainly, shared services at a provincial level was one of the mechanisms. Through the Clinical Preventative Services Plan, targeted practice improvements. So, for example, blood utilization and how we utilize the scarce resources of blood distribution. Digital health, new province-wide better contracts. So now you're negotiating at the provincial level. Supply chain improvements, so better contract management and category spending, again, purchasing provincials at a provincial scale. And I do want to place on the record that all savings are reinvested back in the system and they are not extracted from the system. Thank you.
The member for Union Station.
I thank the minister for that response. I actually just need a little bit of clarity on the patient transfer claims. The minister had provided a bit of a breakdown there, which I do appreciate, but I'm wondering if she can advise as to, she said 65 claims were made in total. How many of those claims were approved? Did the minister mean that the 65 represents 65 folks who applied and all 65 were approved? Or could you just provide clarity on if 65 claims were made, how many of those claims were approved and resulted in the amount that she broke down? And then after that, I'll be asking a question about ER waits.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for seeking clarification. I do not believe that any have been denied of the 65, but I'm seeking clarification of that. Again, the total is $40,951 and it's 65 claims. I do not believe any have been denied. So there was in my breakdown $5,465 in process, but that is in process of being paid. So the individuals haven't actually received their payments as of yet, but I will clarify all of that. Thank you.
The member for Union Station.
I thank the minister for that clarification. I do appreciate it. I'm wondering if the minister can provide some clarity now on the area of emergency room wait times. So last month, it was reported, so that's, well, I guess almost last month, or May, so I'm talking about March, so actually a couple months now. Winnipeg emergency rooms saw the highest wait times that they have on record. Waits were alarming, I think, to all of us at Winnipeg's busiest hospitals, including 8.7 hours at St. Boniface and a very concerning 10.5 hours at HSC. I've been able to speak with doctors and nurses and healthcare aides at all of our emergency rooms. I've had conversations with folks at St. Boniface and HSC and the Grace over the past many weeks. And it's really challenging what folks are facing. Healthcare workers are doing their absolute best, and they're doing incredible work. Really, they're doing heroic work, given the circumstances that they're in. But this is a challenge that is really overwhelming folks, not only providing care, but certainly incredibly difficult for folks accessing care. We do know that folks have even left emergency rooms without being seen as a result. How does the minister account for this large spike in wait times for emergency care?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. And I do want to say that our healthcare workers are heroes. And that's why we celebrate our nurses this week. That's why we're celebrating our allied healthcare workers. And that's why so many times I have risen in the House to say thank you. And I want to put it on the record again that I thank everyone in the health system for the incredible work they've done over the past 2 years during a very, very difficult time of the pandemic. And I recognize that there are still many challenges stemming from the pandemic, and that patient flow issues continue to be a concern for the health system. And a number of initiatives have been implemented in the recent weeks, and those initiatives have come forward from the hospital floor. So it's our health system leaders talking with staff in the emergency department, talking with leaders in those departments to generate ideas. And so these ideas come from them. The expansion of the physician in triage model of care at Health Sciences Center. This pilot program places a physician in the triage area to manage and provide care for those waiting to be seen, with a particular focus on higher acuity patients. The leveling of transport arrivals across all sites, and then improving lab turnaround time for patients requiring admission. We expect these initiatives will have some success in reducing those wait times. And further initiatives are in development. And again, system leaders from both Shared Health and the Winnipeg Regional Health Authority continue to meet with staff and physicians to discuss their concerns and share ideas on how to improve patient flow and reduce wait times. And we also continue to recruit and retain nursing staff at all sites. Some of the early interventions, again, in terms of our ER wait times and program enhancements, we are making changes to ambulance transport protocols to redirect appropriate lower acuity patients to an urgent care instead of an emergency department. The pilot test for COVID-19 within the emergency department, again, for new patient arrivals, early evidence is that this is streamlining the process and allowing for quicker patient flow. We are refining both the interregion transfer protocol and the virtual COVID outpatient program to better assist in maintaining medicine bed capacity in our biggest acute care facilities. We're recruiting to fill nursing and other roles across the system. Our community and long-term care teams are improving flows for patients ready for discharge so that they can move to their personal care home faster. With improved summer and spring weather, our interregional transfers of individuals who no longer require acute care. Clinicians continue to look at that. I've already talked about the physician and triage program. I also want to share that $1.2 million has been committed to the Health Sciences Center for the implementation of that physician and triage program. And just to be very clear on the record, the new investment will place a senior attending emergency department physician in triage on a daily basis at Health Sciences Center Winnipeg, alongside a triage nurse and a nursing assistant. And this model of care ensures all higher acuity patients are triaged by a physician while waiting to be seen, and reduces the rate of patients who leave without being seen by a physician. So I know that the member for Union Station raised that as today, and we are waiting for early results on a reduction in the individuals that are leaving without being seen. And we expect this program to also begin very shortly with an expansion to St. Boniface and Grace hospitals, and that will certainly help all Manitobans who are accessing care. It's the first point of access to our health system. We want to ensure those wait times are reduced, and that Manitobans receive care in a timely and efficient manner. And again, I thank all our healthcare workers for the phenomenal job that they have been doing.
The member for Union Station.
Thank the minister for her response. And I appreciate that she provided some clarity just now on initiatives around folks leaving emergency rooms without being seen. Can the minister provide the most current information she has in terms of how many people are leaving emergency rooms without being seen? What is the current number that they have for that?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. This information was accurate as of for last month. So patients who left without being seen by a physician comprise 13.6% of all emergency and urgent care visitors last month. So this would have been for April. So in other words, 1 in 7 people going to urgent care or emergency were leaving without being seen. But those numbers I want to add was before we initiated the programs that I mentioned earlier the expansion of the physician and triage program, the leveling of transport arrivals across all sites, and improving lab turnaround time for patients requiring admission. I do not have that updated information since these programs were implemented at Health Sciences Center Emergency Department, St. Boniface Hospital Emergency Department, and Grace Emergency Department. I would have to take that under advisement and bring that information back.
The member for Union Station.
I'm good with that being taken under advisement. I appreciate the minister's willingness to do so, and I thank the minister for her providing clarity around the current number of folks leaving. And I know the minister, like I am and many others, are concerned about that number of folks leaving emergency rooms or urgent care and what that means for their well-being. But certainly I know that, as the minister has indicated, that physicians, healthcare aides, nurses, allied health professionals are doing their best to address these concerns and come up with unique strategies. Certainly the government has a significant role to play in terms of providing adequate resources to achieve more positive outcomes, in terms of repairing relationships with healthcare workers, satisfying things like agreements that healthcare workers, some of which still don't have in place, recruitment and retention being a really big component here. So, recognizing that there's a lot of work that needs to be done, certainly on behalf of the government, to help support the efforts that are being made on the front lines by these health folks and leaders. Wondering if the minister can provide some clarity around acute care budgeting. So the funding by this government for acute care, I'm just going to outline what that's looked like recently. In 2017-2018, budgeted funding for acute care was $2.458 billion. In this year's budget, 22-23, it is $2.525 billion. Now, over the 7-year span, six fiscal year span, that's an increase of just 2.7%. Given the acute care crisis that we're seeing right now, given all of the challenges that are glaringly obvious in acute care, why is the minister and the government providing such limited funding to acute care?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. Similar to what I indicated previously, COVID payments for service delivery organizations and personal care homes are outside of our health budget in internal service arrangements and paid out there. So if it's related to mental health as well, acute care funding for mental health, it's now under the Ministry of Mental Health and Community Wellness. If it's COVID, it's in the ISA budget. And if it's related to collective agreements that fall under acute care, then it's again in ISA. So just wanted to provide some clarification there so that the member is aware of how the funding is divided up and is being allocated to different areas. Thank you.
The member for Union Station.
I thank the minister for that, providing that clarification. I do understand how those resources are distributed. And I guess my question really would be then, does the minister think that this amount of funding for acute care is adequate? Also looking at the funding that's provided for the regional health authorities, SDOs, when we look at what those numbers by percentage actually look like year over year, and certainly where things are at now, we are still looking at percentages that are well below the rate of inflation. And so when I look at over 6 fiscal years, an increase of just 2.7%, even looking at the ways in which these other resources are allocated, and given the crisis in acute care, I'm wondering if the minister thinks that the amount that's being provided here is really adequate. Percentages, even when we look at the way that these resources are being distributed again, and we look at these funds regionally, to me, looking at the math here, it is clearly insufficient. And there's a crisis in acute care. There are challenges that we're going to see as we move forward, given the crisis in healthcare staffing. There's a staffing shortage crisis, not just nursing, but we're also looking at allied healthcare professionals as well. So with all of that in mind, is the minister saying that the percentage that we've seen over the last 6 years and where things are at for acute care funding is adequate?
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honorable member for Union Station for giving me the opportunity to read into the record our government's investment in the health system. $7.2 billion total for healthcare in budget 2022. That is the most significant healthcare investment in the history of our province. $1 billion more than the previous government ever invested in healthcare. $3.1 billion pandemic supports to protect the lives and livelihoods of Manitobans. $630 million to strengthen the fight against COVID-19 and prepare for other variants and pressures on our healthcare system. $30 million to add 28 additional beds to our intensive care units, increasing our bed baseline up to 100 from 72. With regard to the Diagnostic and Surgical Recovery Task Force, a very significant investment, Mr. Chairperson, $110 million to address the surgical and diagnostic backlog for a total of $160 million. $10 million to improve priority procedures and wait times. $4.9 million to expand the Concordia Hospital's orthopedic surgery program with a 5th operating room that will add 1,000 surgeries annually. $400,000 in the spine assessment clinic to increase the number of assessments for Manitobans, ensuring 900 patients receive their treatment or care plans sooner. A new mobile CT unit and 2 new mobile MRI units, which will soon deliver nearly 12,000 CT scans and over 7,000 MRIs annually. We have also invested $19.5 million to add 259 additional nurse training seats this year as part of our plan to increase seats by 400. $11.6 million to add the next phase, permanently expanding our nursing seats in Manitoba. $4.3 million was also announced for 37 additional nurse training seats at the University College of the North. $23,000 of financial aid for each internationally educated nurse applicant. Each individual will get help with fees to obtain their licensure. In addition to these investments, we're hiring 35 more paramedics across our province. And for the members' information in terms of capital investments, $2.3 billion in our targeted healthcare capital plan for projects. $141 million for the St. Boniface Hospital Emergency Department redeveloping that will triple the size of its emergency department. $8 million for the new acute stroke unit at Health Sciences Center. $812 million to build, expand, and fix our healthcare facilities in all regions of our province in support of Manitoba's Clinical and Preventative Services Plan. $283 million for a 90-bed new hospital in Portage-La Prairie. $127 million for a 60-bed new hospital in Neepawa. $70 million to enhance and add 30 additional beds at the Brandon Regional Health Center. $32 million to enhance and add 23 additional beds at Steinbach's Bethesda Hospital. $64.4 million to enhance and add 24 beds at Boundary Trails. $31.6 million to enhance and add 30 additional beds at the Selkirk Regional Health Center. $5 million for a new emergency department in Dauphin. $10.8 million to enhance and add 12 additional beds at the Lakeshore General Hospital in Asher. And Mr. Chairperson, for the record, our government will be making more investments, more announcements to improve healthcare services for Manitobans. Our government was elected to fix our services, Mr. Chairperson, including our health services. And that is what we're going to do with our record $7.2 billion.
The minister's time has expired. The member for Union Station.
Thank you, Mr. Chair. I can't in good conscience thank the minister for that response. That was, I think that was just an exercise in wasting time. And I'm sure that there's some element of strategy on the part of the minister to avoid answering questions. My question was very clear. A simple question as to whether or not the minister thinks that the funding she is providing for acute care and has been providing over the past 6 years is adequate. For the minister to go on and list line by line funding announcements, to me it's irresponsible, quite frankly. It's a poor use of the very limited amount of time we have in estimates, and the minister should have been able to, with confidence, state whether or not she believes the funding they're providing for acute care is adequate. I don't understand where the minister thinks it's reasonable or appropriate to spend 5 minutes to go over funding announcements instead of just providing a clear response to a very straightforward question. I would ask that the minister, refrain from doing so. We have a very limited amount of time in estimates in this committee to get some questions answered on behalf of Manitobans, and this information is really important. So I'm going to move on to family medicine, and I'm going to take the minister's previous response to indicate that she probably doesn't think the funding that she and her government are providing for acute care is adequate. Otherwise, I think the minister would have clearly responded that she does, and she didn't. She did something else totally unreasonable instead of just providing a response. So I'm going to take that as the minister indicating that she probably recognizes that the funding to acute care is insufficient. In regards to family doctors, we know that primary care is so important. We know that people being able to access primary care by way of a physician or nurse practitioner is very important in terms of having good healthcare outcomes in Manitoba. We also know it's gotten harder to get timely access to a family doctor in our province. Manitoba's family doctor finder actually shows a deterioration in that. Things were quite bad in this regard before the pandemic as clinics were closed. Clinics like Uncorden and St. B. Timely matching to a primary care provider to a physician fell to less than 16%. It's still taking too long at this point. Last year, nearly half of those folks seeking a family doctor waited for more than half of the target time to be matched, that target time being 30 days. What is the minister doing, actively doing? What steps is she taking to ensure timely access to primary care physicians?
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I want to start by saying I'm very disappointed to hear the information the member for Union Station has placed on the record about acute care and my listing of the significant investments our government has made in acute care. The last time I checked, intensive care unit beds were in acute care facilities, and the $30 million I mentioned to add 28 additional beds to intensive care is an investment in acute care. The last time I checked, Concordia Hospital was an acute care facility, and orthopedic surgeries, adding another operating room is acute care funding. So I'm very disappointed to hear the member try to dismiss that information as not being funding of acute care. And I know that it hasn't been that long since the member left the health system to join politics, but perhaps they have forgotten what encompasses acute care. So to the member's question about timely access to primary care, I'm pleased to see from the College of Physicians and Surgeons a steady increase in the number of physicians entering our province. In Manitoba, going from 39 in 2012 up to 89 in 2021, and all the other investments that our government has made in terms of allowing for virtual tariffs during the pandemic. So there were individuals who expressed concerns with having to go in person to see their physician during the peak of the pandemic, and our government and health system allowed for virtual tariffs to be billed for virtual appointments to occur. Under our clinical and preventative services plan, we have a primary care provincial clinical team that is looking at certainly ensuring that we are a welcoming health system for new primary care providers. I know that myself, I do a lot of mentoring of young people from the Black community and have had an opportunity to work with what I understand is now a group of physicians that have formed a formal group of Black physicians that are helping other young people from the Black community to access our health system as physicians. And I was really pleased to hear about their program and how they're helping with those efforts. And then our distributed medical education program through the Rady faculty in the University of Manitoba, how we're supporting our U of M medical school in terms of ensuring that when practitioners and physicians come to the system, they are being recruited and trained to work across the province and not just in Winnipeg. And I was pleased to join my colleague in Beausejour, where we welcomed 9 family physicians who started to practice in communities across the Interlake Eastern Regional Health Authority. So 4 of the new physicians were graduates of the 1-year medical licensure program for international medical graduates offered through the U of M, which is designed to integrate physicians who have practiced internationally into the Canadian medical system. And the program allowed physicians who have practiced internationally to better understand the needs of rural patients. And then the 4 graduates would be working in rural and underserviced areas of the province and have made a 4-year commitment to the region. And that was just last summer. So they're just completing their first year. So we have many efforts underway. We will see more come to fruition through our clinical preventative services plan. We are committed to all our healthcare providers at various levels of our organization, not just in Winnipeg, but in rural Manitoba, in northern Manitoba, to ensure that care is provided closer to home. And again, we will continue to make our acute care investments, that I listed earlier and in support of the work that our clinicians
The
do.
honorable minister's time has expired. The member for Union Station.
Thank you, Mr. Chair. I'd like to ask some questions around the surgical backlog. This is an area that every person in Manitoba is in some way, shape, or form impacted by, whether you yourself are waiting for a test or procedure of some kind, or you have a friend or loved one who is a significant portion, about 10% of our population, is either waiting for a surgical procedure or diagnostic test. I'd like to point the minister to page 54 of her last annual report. So that's the report for 2020, 2021. This shows that spending on what's called priority procedures, wait times reduction. So under that category, the minister would know that with a growing and aging population, enhancements need to be made at regular intervals just to keep wait times in check. That's just the reality of the ever-increasing aging population. And it's not just happening in Manitoba. We know it's happening elsewhere, everywhere, across jurisdictions. Unfortunately, after the PCs, after this minister and her government were elected, for several years, the government did not make any enhancements in this area. As the minister would imagine, that means that there's going to be potentially poor outcomes, challenging outcomes, but certainly wait times got worse for priority procedures. This was actually reflected in Kai-High reporting. And so belatedly, we saw in the 2020-2021 budget, the PCs did announce $10 million for priority procedures. Unfortunately, quite surprisingly, shockingly, given the state of things and how we know things are progressing, that budget line was underspent by 26%. So, of course, we know that Manitoba's wait times for priority procedures, as a direct result of that, have continued to get worse. They've been deteriorating as a direct result. Can the minister provide clarity around why this funding, $10 million that was budgeted for 2020, 2021 for priority procedures, why it wasn't fully spent?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. Before I answer that particular question, I do have an update on the patient flow reimbursement. I would like to complete that if I may. So the $40,951 that I mentioned, so all 65 claims have been approved, and that total number is the $35,486 is already paid out, and the $5,465 is approved, and payment is in process. So I can state that the 65 claims is now completed. I also want to respond to the member's question about the $10 million for priority procedures. That funding was provided in April of 2020. And as the member is aware, the pandemic was officially announced the month prior to that in March of 2020, which led to a slowdown in procedures. So to ensure that we continued to provide Manitobans with care, and that slowdown, just let me clarify, the slowdown in procedures was within our health system. We launched what we now refer to as our request for supply arrangements, or RFSAs, so that we could increase the number of procedures that were being done outside of the health system that was very under an immense amount of pressure and was quite taxed. To date, we have completed 5 requests for supply arrangements for surgical services to address the backlog. 11,000 procedures have been contracted. 13.7 million has been spent and allocated to date. 8.1 million for the first 4 RFSAs. 5.6 million in service delivery organizations on priority procedures, including hips, knees, and cataracts. We are now working on our 6th RFSA, which includes endoscopy, cataracts, pediatric general surgery, dental and ear, nose, and throat, outpatient spine procedures, adult ear, nose, and throat, and general surgery. So in terms of the dollars that the member mentions that was underspent, we were in the midst of a pandemic, and the system was undergoing an unprecedented change in terms of redeployment of staff, in terms of a decrease in surgeries, and we moved to an RFSA process, have been able to use that RFSA process to sign agreements such as the one we're working on now with Maple Surgical Center, which will provide women with hundreds of gynecological surgeries. The Sanford Health in North Dakota has helped to provide spine surgeries. We're doubling the number of anesthesia clinical assistants in the province, working with our colleges for nursing and regulatory colleges to look at staffing models. And so we have certainly been asked to pivot and be innovative and creative in terms of being able to provide surgeries and services to Manitobans. We have that money in our budget, and the Diagnostic and Surgical Recovery Task Force is working to ensure we continue to provide surgeries for those priority procedures. An update will be coming from the task force very, very soon. And more good news for Manitobans who are receiving their surgeries and their diagnostic tests. And again, I thank all the healthcare professionals that have returned to their programs, their acute care facilities, their personal care homes, all across this province for the incredible work that they did to make these RFSAs and the procedures that have been done a success. And we will continue to work closely with them as we move forward.
The honourable member's time has expired. The member for Union Station.
I thank the minister for that response. I would like some clarification because that $10 million for priority procedures was actually seen again. So it appears again in the budget for 2021, 2022, so last year's budget. Can the minister indicate how much of that funding is the department projecting has been spent? And interestingly enough, that same budgetary amount, $10 million, appears in the budget for this year, for 2022 and 23. Does the minister believe that that funding will actually be spent in its entirety for this year? So can the minister provide clarity around whether or not the $10 million, which appears again for last year's budget, how much of that is the department projecting will be spent? And how much of the $10 million that's in this year's budget, or does the minister think, rather, the $10 million in this year's budget will be spent in full?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. My apologies. I'm not sure why my screen blanked out. Thank the Honourable Member for Union Station for the question in terms of why it's appearing year after year. This is an ongoing commitment that came from the wait times report in 2017, and that request, that recommendation was part of that report that came forward from frontline physicians that our government would continue to invest $10 million on an annual basis, specifically for priority procedures. The numbers are still being finalized for 2021, 2022, but what we're seeing right now is that we will be surpassing the amount of the $10 million. So the $10 million will be fully spent and more. And for this year, again, it's a commitment of $10 million for priority procedures. And I anticipate that the $10 million will be fully utilized. We have many Manitobans that require care, and many of those are priority procedures, and we want to ensure that all of those funds. So to the member's question, 21-22, we're on track to fully utilizing all of those funds, and again for 22-23. Thank you so much.
The member for Union Station.
I thank the minister for those responses. I know that she said that they would go over and above the $10 million allocated in last year's budget. If the minister could provide clarity around how much has been, what they do have in terms of what has been spent. So the most recent calculation that they have would be great in regards to 2021 and 2022. I'd also like to ask the minister about funding priority procedures. Sorry, I apologize. Last year's fiscal year, the government, this minister and her government, announced a general annual contribution for all procedures of $50 million specific to the surgical and diagnostic backlog. This year's budget presentation, so 2022, 2023, shows the line for last year as $40 million and not $50 million. So a discrepancy there. In addition, in March, at the very end of fiscal year 2021-2022, the minister reported that $13.7 million of the $50 million had been spent or allocated to date. That's what the minister reported. So can the minister explain why the estimates of expenditure for this year show that last year's commitment to the surgical and diagnostic backlog was $40 million and not $50? And that's on page 156 of the budget estimates of expenditure. So I just was seeking clarification if the minister could clarify for us. If the minister could clarify for us, and I've now lost my train of thought on that. Yes, sorry, for last year, for the $10 million for priority procedures, where things are at in terms of that spending, that would be great, just whatever calculation they have to date for that. And then just clarify why on page 156 of the budget estimates for expenditure, why it says $40 million for the backlog and not 50 as indicated.
The Honourable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honourable member for Union Station for the question. I do want to answer the previous question that they asked, and that was about the 2021 priority procedures and how much we are estimating to spend against the $10 million budgeted. Preliminary estimate for 21-22 is $10.9 million. Again, that number has not been finalized, so I emphasize the word estimate. I also want to answer the subsequent question about the $50 million. And so on an annual basis, our government is supporting the recommendation of the wait time report with a $10 million investment. So in 2021, there's $10 million for priority procedures. And then health system capacity enablement was $40 million, and that totaled $50 million. So the $50 million referred to in 2021 was a combination of two things: the $10 million for priority procedures and the $40 million for the COVID backlog.
The member for Union Station.
Thank you, Minister, for that question. Can the Minister update us on how much of that funding was actually spent, not just allocated? And I'm speaking specifically, just so that I'm clear, I'm speaking specifically to the diagnostic and surgical backlog funds that the Minister had announced, the $50 million that were announced by the Minister, rather. So I'd like the Minister to be clear on how much was spent directly on surgeries and procedures. So an update on how much of that funding was actually spent, not just allocated, and clarity around what was spent directly on surgeries and procedures. Previously, and I'll give us as an example, we've raised this recently, that previously the government has suggested things like doctors' billings for meetings were being counted as part of that $50 million. So I really am just looking for clarity around how much was directly spent on surgeries and procedures. Thank you. Okay, I'm done.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I'm going to have to spend a bit of time explaining how medical remuneration works for our diagnostic and surgical recovery backlog. So of the 50 million, 13.1 million was for the first 4 requests for supply arrangements that led to 11,000 procedures which came from this, which include cataracts, endoscopy, cataracts, pediatric general surgery, dental and ear, nose, and throat, outpatient spine procedures, adult ear, nose, and throat, and general surgery. 2.1 million for initiatives through the Diagnostic and Surgical Recovery Task Force have totaled for the initial activity like fit testing and spine surgery. 34.8 million for medical remuneration for physicians. And so, you know, I'll give you an example. So someone has a cataract down at Western Surgical Center. We bill, Western Surgical Center bills us for the surgery time, for the space. Oh, I'm gone now. Okay. We've got to sort this out, guys. There's got to be LDIS power.
We can hear you, Minister.
Then?
The Minister of Health.
Thank you, Mr. Chairperson. Can I continue without video?
We have video.
Oh, I can't see you, so I'll just continue. So if Western Surgical Center, for example, does a cataract surgery, they will bill us for the surgery time, for the surgery room and equipment. And then the doctor that performed the cataract will bill us under medical remuneration. So the 34.8 million can include anything from the person seeing their physician to begin the process leading up to their surgery. So I just want to clarify that, because there seems to be some misinformation in the public sphere about the monies that are being paid out under medical remuneration, but it is for individuals who might even be starting their journey towards their surgery, have completed a test where we are billed under medical remuneration. Thank you.
The Honourable Member for Notre Dame.
Good afternoon, Minister. Advocates, IENs, and even the former Fairness Commissioner have identified specific requirements and processes that have been mandated by CRNM, or the College of Registered Nurses of Manitoba, that have acted as unfair barriers to IEN accreditation. Last spring, your government passed some amendments to the Fair Registration Practices and Regulated Professions Act, and that legally allowed for more government discretion in determining these outcomes for accreditation for these regulated professions like nursing. Has the minister availed of these new powers to carefully present compliance orders to CRNM to compel them to remove certain unfair barriers that advocates, the former Fairness Commissioner and IENs themselves have raised to you? And if so, could you please describe the nature of those compliance orders? Thank you.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the honourable member from Notre Dame for the question and welcome her to the committee table. Internationally educated nurses and supporting those nurses is certainly a priority for our government. That is why we have made available $23,000 for each internationally educated nurse to gain licensure and to practice at their full scope here in this province. And we continue discussions. I was pleased to meet yesterday with the Association of Regulated Nurses of Manitoba, talking about how we can better support our internationally educated nurses. And it was in the first half of 2021 that the first compliance letter was issued to the College of Registered Nurses of Manitoba. Since being appointed health minister in August of 2021, I've had several meetings with the college, and my latest meeting was May 11th, just a couple of days ago, where we both spoke about the need to streamline the process, to work with our colleges and our Red River College and our advanced education institutions to streamline the process to licensure for our internationally educated nurses. So conversations continue to be held. We also have tripartite Assistant Deputy Minister working group that has been formed between the Ministry of Health, the Ministry of Advanced Education, the Ministry of Economic Development and Trade. So everyone is coming to the table because it is going to require that whole of government approach to addressing the needs of internationally educated nurses, as well as working with the colleges. And the Manitoba Nurses Union, I've had many discussions with them as well. So we continue to work through the challenges that we have seen, and I stand committed to ensuring that we streamline the process to licensure for our internationally educated nurses. Thank you.
The member for Notre Dame.
Thank you for that response, Minister. And speaking of the IENs in Manitoba project portal that was rolled out last summer, this is a project that would purportedly provide funding to Manitoba IENs for the various steps and requirements involved in the recognition and registration process. I'd like to know how many folks have been successful applicants to this project, and how much funds in terms of the grants have been dispersed to this date.
The Honorable Minister of Health. We have no video or audio of you.
We've got video. We've got video.
We've got video, but no audio.
She's currently muted.
The Honorable Minister of Health.
She needs to unmute.
Could the minister unmute?
Thank you, Mr. Chairperson. I'm pleased to answer the honorable member for Notre Dame's question. This program, which is one of the reasons we have this tripartite working group, is managed, the funds and the number of individuals that are moving through their portal is handled under the Department of Economic Development, Investment and Trade. So that information would need to be taken under advisement or asked during their Committee of Supply.
The member for DePaul-Camisac.
Thank you, Mr. Chairperson. I just want to clarify.
Amanda, can you just say that we'd like to take it under advisement?
Oh, okay. We'd like to take this under advisement?
Previous question. Under
With the previous question, Minister.
The Honorable Minister of Health. We cannot hear the minister. Could you be unmute?
Let's stop the clock for a second. Have you been able to get into the Zoom? Yeah. Okay.
We are working to get your audio restored.
I don't think it's our end. We're not muted.
Could the minister check if
We can hear.
if they're muted?
Can
'Cause
you
we
hear me
cannot-
now?
There we go.
We can hear you now. The
Oh,
Honorable
okay.
Minister of Health.
Thank you, Mr. Chairperson. We can take these questions under advisement and seek that information from another department, which is where the information is held. Yes, we can do that.
The member for DePaul-Camisac.
Thank you, Mr. Chairperson. I had walked in the middle of numbers when you were talking about transportation. I'm from, obviously everyone knows here, I'm from northern Manitoba. Is there a difference between that NP, Northern Patient Transportation Program, versus the conversation I had just walked in when we were quoting $70 per night allotted for patients from northern Manitoba? So can you clarify that? Is that two different fundings or is that the same?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Can you hear me now? Okay, and I thank the member for the DePaul-Camisac for the question. So you may have entered the room when we were talking about the financial hardship supports for individuals that are experience patient transfers, interregional patient transfers. The Northern Patient Transportation Program is different. So that was established in 1972 as a reorganization of the former Patient Air Transportation Program. And it covers individuals who are residents of Manitoba, located in one of the applicable RHAs and are registered with Manitoba Health. And individuals can receive a travel subsidy for certain travel expenses incurred while traveling to access an insured benefit, being referred by a physician for a medically necessary intervention not available in the individual's community, subject to the Northern Patient Transport Policy, traveling to the closest appropriate location, and traveling by the lowest cost travel option that is medically appropriate. So that they're two, it's a different program.
The member for DePaul-Camisac.
Thank you, Mr. Chairperson. Since it's a different program, can you name, are the rates still the same as in hotel and meals per diem? Because I could tell you for a fact, when one cannot cover the other half, usually hotels go for $130 a night, depends where you are. Most of our people where I come from can't afford to come down, pay for the hotel, and meals is like $8 You know, it just forces people to go eat at fast food restaurants at that rate with our diabetics. Is there going to be a time where these rates can go up so our patients from Northern Manitoba will feel more comfortable and safe and more ensured that they can receive their medical needs instead of having to have money in their pocket or money in their bank accounts?
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and thank the honorable member for the PAW-Camisac for the supplementary question. So this is a travel subsidy. It's a transportation subsidy to residents who have to travel long distances to obtain medical care in the province. First Nation Inuit Health covers transportation for on-reserve status clients through the non-insured health benefit program. So this program is unique in Canada. Manitoba is the only province that provides a transportation subsidy. Again, it's to residents who have to travel long distances to obtain medical care.
The member for DePaul-Camisac.
Thank you, Mr. Chairperson. I'm very aware what this program is all about. But again, in order to prevent people from neglecting their health by not having money in their pocket to attend these long-awaited appointments for our people, not just for Indigenous people, but all of our Northern Manitoba. I don't live on reserve. I live across the river, and I would have to go under MPTP, not on reserve, which is just across the river. It's ridiculous. Anyway, will these rates be increased so we can feel safe and comfortable to travel to Winnipeg, access health, instead of having to worry about money, cancel appointment, and hope you have money in your pocket next time? Because this really is detrimental to our health, money.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I thank the honourable member for the PAW-Camisac for the question. And in my time in the health system, I traveled quite extensively in the north and in rural Manitoba as well, and I'm very familiar with the patient transportation program, and that it is a transportation subsidy. It does not, for the members' information, does not include meals and ensuring a person has cash on hand for out-of-pocket expenses. It's specifically a travel subsidy, and just want for the record to state that our government has doubled the NDP's funding of the program from 7.9 million to 18.1 million So we are investing in the program. We recognize that individuals need to be able to travel from their remote communities into Winnipeg and other locations for care. Again, it's a transportation subsidy. It's unique in Canada. See, we're the only province that provides the subsidy. And again, it's to residents who have to travel long distances to obtain medical care in the province.
The hour being 12:30, committee rise.